Hey Shalom YouTube, Sister Kate here. If you can't hear it in my voice, I've been sick for like a week, and I've put on my Facebook page that this is like a 6 Kleenex tissue box cold, and it is. It's a bad cold, and both Pastor and I had it. And then about halfway through it, Pastor started developing a fever, sore throat, and like heavy nasal congestion. So we assumed what he had was a sinus infection because that's what normally happens in our family. And we went to that conference, and Pastor wanted to get through that, so he didn't want to break in the middle to go to the doctor, but his fever was getting pretty high, and then he started developing a red rash on his face right here, his nose first, and swelling, and then out to here. And I'm here to tell you as a medical person that that rash spreading in not collusion, but at the same time that he's got this cold thing going on and heavy dripping out of his nose, which is turning yellow and green, is an indicator that you've got a spreading infection. And you're if you get any red like lines or streaks coming down your skin from an infected area, that is a sign that the infection has spread into your bloodstream, and that's called septicemia, and that can be fatal. So what are you going to do in a grid down situation? What are you going to do in the apocalypse or Teowaki when that happens to someone in your party and you can't just go to an emergency room? You need to be able to treat yourself with antibiotics if you don't have a spiritual or whatever problem with antibiotics. So how do you get them? There are many videos out on this already. I'm just going to give you the same information. You can get them on the internet for fish, pets, and it's in pill form. So you just type it in there, and you know, pet antibiotics or fish antibiotics, and you can order them, and they're pretty affordable. The thing is, antibiotics nowadays are pretty specific to what you're suffering from. Like, there are the heavier, dutier ones that are for things like pneumonia, and then there are some that are for internal things like in your sinuses or your gut system. So if you can get a variety, that's a good idea. If you want to research, you know, what amoxicillin is really good for, I mean, most moms know that's really good for ear infections, but that way you can sort of pinpoint which ones you're going to get. Also, you can get them in co-ops and farm stores if your state is not one that's heavily regulated. If they sell them in your farm store, you can buy big bottles of penicillin and things that are meant for cattle and horses and everything else. Now you got to scale down the dosage, and many of those will not have a pain relieving element in them. So if you just straight inject that into a human, that person's going to suffer burning and discomfort and everything at the site. So there is penicillin with procaine, and you want to look for that, because what that means is we have penicillin, but it's got something else in it, so that the animal you're injecting it into, and goats are very sensitive about that, so penicillin meant for goats should have something like that in it. So when you're injecting it, you won't have the reaction and the pain and the swelling and everything that would come from just straight up. The thing about penicillin is it is a good antibiotic. It's very strong. What people are saying nowadays is that, you know, you get a resistance to it, but I don't think 2 or 3 times in your lifetime will make a resistance. I think penicillin resistance comes from people with chronic issues who have had multiple doses of it over their lifetime. So it's probably still good for you. Anyway, I just wanted to put that out. It's just timely information for y'all and suggestions so that you can get on it if you have not already. And God bless you. Shalom! Okay, shalom. One other little tip, a little add-on. Signs of an infection. Okay? Infections are bacterial, which means you can treat them with things like Neosporin, honey, garlic, all the antibacterials. They're not viruses. So you are going to kill that infection and cure that person of it. If it's on your skin, it'll be red, it'll be raised, it'll be hot, and it'll start oozing pus. If it's under your skin, you get the same symptoms. You get your skin looking red, it'll get swollen and continue to swell, like, you know, just from normal to really big. Or on your knee or something like that. It'll be red, it'll be hot, it'll be swollen. If there's a break in the skin where the infection is, if there's an opening, then you can put Neosporin and things on it and it gets to the bacterial infection. If the infection is under your skin and there's no break and there's no way to get at it, that is called cellulitis, and that is dangerous. In small cases where it's just some sort of local little scratch or little patch, you can actually puncture your skin and put the antibiotic, the Neosporin type antibiotic, right on that, and it'll get to it. But if it's deeper than that, then you have to treat it with the kind of antibiotics that you're going to take internally, that you're either going to inject or you're going to take them orally. And the ones under the skin are very serious because they are happy to continue growing under your skin. That's the conditions that they like, and they will spread. And they can go to your heart, your lungs, your brain, your kidneys and things, and damage them while they're in there. So you want to get those and get taking care of them as best you can. Also, the above skin bacterial infections you want to be really careful about, because the infected matter, the pus and stuff, if it gets on another open wound, can spread that infection. So you want to be careful about those sort of things, about taking care of those sort of things. All right, just a little bit more tips to help you out. Bless you. Shalom. Okay, second add-on video. Sorry, but I keep thinking of things after I sign off that relate to the original one. What is a normal temperature? Most people know this, most moms know this. A normal temperature is 98.6. You can be a little bit under that and you're fine. You can be a little bit over that and it's an indication that something's going on. When do you start worrying about things? When do you want to start treating for fever? When it's 103, 104 in children, that's a time you might want to start taking care of it. And I'm not going to tell you how, because each person has their own way. But 104 is a high. 105, 106 will damage someone's brain and organs if you let it go on too long. So that is for children. For an adult, 100 is a significant temperature for an adult, because most adults don't get that sick. You know, you've fought germs and gotten over a million colds in your lifetime. So when it starts going up, it's an indication something's happening. 101, 102 for an adult is serious. It is telling you something is going on and this something needs attention, and it probably needs antibiotics. Strep is around the 101, 102. That's an indicator you've got strep going on. Same thing with ear infections. Ear infections start out with 99, but they go up to 101.1 and around that range. And then other things like typhus, they start getting up into the 103, 104 when the person gets delirious and so achy and can't sleep and moaning and everything else. One effective treatment for a fever when you're not doing the oral medications is just a regular bath. It used to be in the old days they'd put you in cold water, but that'll actually shock a person who is, really, really sick. But because a bath is warm enough, but the fever will the temperature of the water will kind of help equal out the temperature of your body, and then when you get out, the water evaporates off you, so it'll help take care of your fever, at least for a while, without doing any damage. And then obviously aspirin, but not in anyone under 18 years old, because Reye syndrome is something that can come out of taking aspirin. Acetaminophen, Motrin, ibuprofen, all those things. And you can use acetaminophen and ibuprofen not interchangeably, but like at the same time, leapfrogging them. You take your Tylenol at a certain time, 2 hours later you can take your ibuprofen, and then 2 hours later you take the Tylenol, and 2 hours later you take the ibuprofen. You can piggyback them that way, and that helps deal with the higher temperatures. Non-oral things you can also do for a fever, obviously, is cooler drinks. Keep people drinking, because dehydration also often has the same kind of symptoms, like achiness and you know, dizziness, lightheadedness, and you don't want to confuse or miss the signs of the more serious illness. So keep the person hydrated. It also helps flush impurities out of the system, so you're helping get rid of, you know, byproducts from the illness. Also, you can put cool compresses on someone's head, wrists, back of the neck. That's where, you know, the blood is near the surface and is going through at, you know, every minute or so, and so you can help cool down the blood that way. All right, I need to finish up, so shalom.